Hey, I'm Ian Waldman. I'm a physician at CCRM in Miami. So an REI is a specialist physician who has completed their training in OBGYN and then completed a subspecialty training specifically evaluating the reproductive hormones of females as well as males, and also the surgical expertise in correcting any abnormalities. And when you should see one, I really encourage all my patients or anyone out there, whenever you think you should see a specialist, if you're not sort of getting the answers that you want, or you feel like you need to see someone a little bit more advanced than a generalist OBGYN, I encourage everyone to see their REI, but there are specific times. So if you're under the age of 35 and you've been attempting conception for 1 year, that's certainly a time that we'd want you to come. If you're over the age of 35 years old, we would recommend doing it at 6 months to come in and see us. But also, not just that, even you don't have to wait that amount of time to come in if you have irregular periods, pelvic pain, any reason that there might be difficulty in conceiving, or you have any like hormonal imbalances and things that you know about or you think you might have. Certainly an REI would be the best place to go to get those questions answered. So a reproductive urologist has a little bit different training than your OBGYN or reproductive endocrinologist or infertility specialist. They go through a urologic specialty, which is an evaluation of the reproductive tract of the male. And then they have subspecialty training in the hormones as well as other like sperm collection techniques for the male patient. So a little bit different, have a little bit different expertise than your REI does. So when you should go see your reproductive urologist is similar to when you should see an REI if there's any issues with maintaining erection, ejaculation, if there's any issues with the sperm counts, those would be potential reasons to see a reproductive urologist. Certainly your REI, oftentimes, or OBGYN, they will start and do a semen analysis for you. And that's typically the first time where some people will realize there might be something going on with the sperm counts, and will oftentimes, depending on what that abnormality is, will refer at that point to a reproductive urologist for further management evaluation, whether it be hormonal management for the male partner or surgical management for them as well. Most patients will start with their OBGYN. I mean, that's the person you've built the relationship with over years usually. And so you'll start there. That's a great place to start. They have a good understanding of evaluation and basic treatments for patients with infertility or endocrine abnormalities. So I would say that's usually where most patients start and then get referred from there. I don't think universally you have to see your OBGYN if you know there's going to be, like if you have a history of infertility or some of the other causes that might get you to just go right to the reproductive endocrinologist. But the OBGYN is absolutely very frequently the first stop for a patient with infertility. And so certainly seeing your OBGYN should be encouraged, and they'll oftentimes do the basic fertility evaluation, and depending on what the findings are, will then from there refer. Not always, sometimes they refer immediately with a infertility diagnosis. I think one of the first things that often is frustrating for patients in coming to see us is that they feel like they have to meet some minimum standard to get in. So for instance, like, oh, I haven't had infertility haven't been trying to conceive for greater than a year at this point. But like I sort of said, there's so many things that would require or recommend that you come and see us earlier. So I'm not so strict in recommending that you wait all that time in order to come in. I love seeing patients. I mean, you should know, I know it's a little bit like hard and weird coming in to see a reproductive endocrinologist to discuss what's a very intimate thing with you and your partner, but just know this is what we're here for. We all universally love seeing our patients and love helping people, and even if nothing else, just giving reassurance would be certainly a worthwhile reason to come in. And if we find something, or if we determine that there's something going on, better to catch it earlier than waiting longer, as we know that the reproductive life cycle can be affected as we age, and so we'd rather see us sooner than later. So anytime you think you should come and see us, as far as I'm concerned, that's a good enough reason to come in and see us.